Hello and welcome. Today we're diving deep into a rare and often overlooked condition affecting the urinary system, urethral amyloidosis. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Get ready to learn about this fascinating and sometimes challenging disease. Urethral amyloidosis arises when abnormal amyloid proteins deposit in the tissues of the urethra. But where do these amyloid proteins come from? The answer is varied. In some cases, it's associated with systemic amyloidosis, where amyloid deposits throughout the body as a result of chronic inflammation, genetic mutations, or even certain cancers. In other cases, it can be localized, meaning it only affects the urethra, and the underlying cause may be unknown, termed idiopathic. Risk factors can include chronic inflammatory conditions, certain plasma cell disorders, and even age. Let's break down what happens when amyloid accumulates in the urethra. These abnormal protein deposits disrupt the normal structure and function of the urethral tissues. The amyloid infiltrates the urethral wall, causing thickening and rigidity. This interferes with the urethra's ability to properly dilate and contract, leading to narrowing of the urethral lumen, or stricture. The narrowing can obstruct the flow of urine, causing a cascade of issues, from urinary retention to potential kidney damage if left untreated. The compromised tissue also becomes more susceptible to inflammation and bleeding. Urethral amyloidosis is a rare condition, making precise epidemiological data scarce. However, studies suggest it's more common in older adults and may be slightly more prevalent in men due to their longer urethra. The true incidence is likely underestimated, as many cases may go undiagnosed or misdiagnosed due to its similarity to other urethral conditions like strictures or tumors. Systemic amyloidosis, which can involve the urethra, has a higher incidence overall, but isolated urethral amyloidosis remains uncommon. The symptoms of urethral amyloidosis can vary depending on the severity and location of the amyloid deposits. Common signs include difficulty urinating, weak urine stream, frequent urination, urgency, and nocturia, which is the need to urinate frequently at night. Patients may also experience pain or discomfort during urination, hematuria or blood in the urine, and recurrent urinary tract infections. In severe cases, complete urinary retention can occur, requiring immediate medical attention. Diagnosing urethral amyloidosis typically involves a combination of clinical evaluation, imaging studies, and tissue biopsy. A thorough medical history and physical examination are crucial. Imaging techniques such as urethroplasty, cystoscopy, and ultrasound can help visualize the urethra and identify any narrowing or abnormalities. However, the definitive diagnosis requires a biopsy of the urethra, where a small tissue sample is taken and examined under a microscope. Special stains are used to identify the presence of amyloid deposits. Further tests may be performed to determine if the amyloidosis is localized or part of a systemic process, including blood tests, urine tests, and potentially bone marrow biopsy. While there aren't distinct types of urethral amyloidosis in the traditional sense, it's more accurate to classify it based on the extent of the disease and the underlying cause. We can differentiate between localized urethral amyloidosis, where the amyloid deposition is confined to the urethra, and urethral involvement as part of systemic amyloidosis affecting multiple organs. Additionally, amyloidosis can be classified based on the specific type of amyloid protein involved, such as amyloidosis associated with plasma cell disorders, or amyloidosis related to chronic inflammation. Treatment for urethral amyloidosis aims to relieve symptoms, prevent complications, and, if possible, address the underlying cause. For localized disease, treatment options may include urethral dilation, which involves widening the urethra to improve urine flow. In some cases, endoscopic procedures like urethrotomy, where the stricture is cut, or urethroplasty, surgical reconstruction of the urethra, may be necessary. If systemic amyloidosis is present, treatment focuses on managing the underlying condition, which may involve chemotherapy, medications to reduce amyloid production, or stem cell transplantation. Close monitoring and regular follow-up are essential to assess treatment effectiveness and detect any recurrence. Currently, there are no specific preventative measures for urethral amyloidosis, particularly the localized form. However, managing underlying inflammatory conditions and genetic predispositions associated with systemic amyloidosis may indirectly reduce the risk. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can help support overall immune function. Prompt diagnosis and treatment of urinary tract infections can also help prevent complications. The prognosis for urethral amyloidosis varies depending on the extent of the disease, the underlying cause, and the response to treatment. Localized urethral amyloidosis can often be managed effectively with local treatments, although recurrence is possible. Systemic amyloidosis with urethral involvement carries a more guarded prognosis, as the disease can affect multiple organs and lead to significant complications. Recent research is focused on developing new therapies to target amyloid deposits and prevent further organ damage. Advances in diagnostic techniques are also improving the ability to detect and characterize amyloidosis earlier, leading to more timely and effective treatment.